Namaskar. I am Dr. Susmit Mishra. I am the head of the Department of Emergency Medicine at Ultimate Medicare. I am going to talk about the topic of anticoagulants and its use in different conditions. Let us start with what is coagulation, what is thrombosis, and what is hemostasis. Thrombosis refers to the formation of a clot or a plug in the veins as well as arteries. In the veins, formation is the involvement of platelet is less, and in the arteries, the involvement of platelet is more. In the arteries, the thrombosis is formed first due to the injury to the blood vessels. Lateral, it is going to form a atherosclerosis plaque, and then there is a thrombosis. Now, what is hemostasis? Hemostasis is the spontaneous arrest of bleeding during a bleeding condition. That is called as hemostasis. Now coming on to what we are actually looking into, it is coagulation. What is coagulation? Coagulation is the conversion of the liquid form of blood into a gel, and then lateral it can be formed as a thrombi and it can go as an emboli as well. So this was the basic difference between thrombosis, hemostasis and coagulation. Now coming on to the classification of anticoagulants that we see and use in our daily life. So first coming on to the in vivo, what we use in vivo. So in vivo, the first thing that is used is either heparin or heparinoids. In heparin, there are two things that we classified further into two types. One is unfractionated heparin or high molecular weight heparin, and the other one is low molecular weight heparin. And heparinoids are the other substance derivatives. Coming on to the in vitro also heparin is used, and there are other clotting factors that we use in our laboratory for blood collections, and there are oral derivatives as well. The oral derivatives that we use in our daily lives are coumarin derivatives like we use warfarin, and there are other things to it. Now when we talk about heparin and we talk about low molecular weight heparin, let us know what is the difference. The first difference is heparin is a high molecular weight, that is its Daltons is almost 30,000 Daltons, and in low molecular weight heparin it is only 2,000 to 3,000 Daltons. Then next is about what are the effects, what are the contraindications, what are the side effects. So heparin is a thing which has been used for long. Low molecular weight heparin is comparatively newer than heparin. But when we see about the time of action, the heparin is short acting, whereas the low molecular weight heparin is a long acting one. Heparin is dose dependent, so the effects and the side effects come according to the dose. But low molecular weight heparin has a longer half-life, so the effect is consistent. The side effects, when we see the chances of bleeding, there are comparatively more with heparin and there it is comparatively less with low molecular weight heparin. Next is the bioavailability. When we administer heparin, the bioavailability is almost around 20 to 30%, whereas in the same case it's of low molecular weight heparin is 80 to 90%. So we give low molecular weight heparins as subcutaneous, and normally it is once a day. But when we give heparins, it can be twice a day, and depending on the dose, we can titrate it. Now when we give heparin, a monitoring is required. So we require monitoring of heparin, and accordingly we adjust the dose. The monitoring of heparin is done by monitoring the APTT. But as the same case, in case of a low molecular weight heparin, we don't need monitoring because we know about the longer half-life, and so accordingly we can titrate it. Coming on to the advantages. What advantages do low molecular weight heparin have over heparin? As I told that the chances of bleeding is comparatively much lesser with low molecular weight heparin. So it has a longer half-life, so we can give once daily. But in case of a heparin, it depends on the dose, so we have to give according to the titration. And in a case of heparin, the chances of bleeding are much more than of low molecular heparin. But at the same time, when we decide that how they act, low molecular weight heparin, it only inhibits the 10A factor, but in case of heparin, it inhibits both 2A and 10A, so it can be reversible. If we have a side effect in case of heparin, it is reversible. We give protamine sulfate, which is a drug which is used to reverse the side effects of heparin. But at the same time, in case of a low molecular weight heparin, where there is chances of adverse effects are less, in that case we can give protamine sulfate, but the action is comparatively much lesser. Now let us go on to the uses that we have of heparin as well as low molecular weight heparin. The first thing that we see in a use of heparins is, first it is used in thromboembolisms like deep venous thrombosis, normally in immobilized patients, in old age patients, in post-surgical patients, in post-stroke patients, in leg fractures patients, and sometimes in elective surgery patients as well. Next is in case of a cerebrovascular accidents or myocardial infarctions. So if there is a emboli which has gone on from a thrombi, it has gone on to be an emboli and it has blocked an artery, we can give heparins as well as low molecular weight heparins. Next is in case of vascular surgeries, prosthetic valves, like in rheumatic heart diseases, and even in hemodialysis we give heparins because there is a chance of clotting in the vessels when we are hemodialyzing a patient. And then in other conditions also it is used, like cases of disseminated intravascular coagulation, or we can say in cases of pregnancy. In those cases we have abruptio placenta. In those cases also we do use heparin. Now what are the adverse effects that we see with heparin and low molecular weight heparin? So the main thing that we see is, first of all, is bleeding. Then there can be allergy and anaphylaxis. There can be increased hair loss. There can be osteoporosis, long bones especially. There can be spontaneous fractures, and there can be thrombocytopenia as well. So going on individually, if you think about, we see in a case of heparin induced thrombocytopenia. So what happens is, when we give continuously, we are administering heparin to a patient, the platelet levels go down. So in that case, we have to immediately stop the heparin, and then we should not administer platelet. Now you might ask why we use platelets. The thing is that when you give platelets, there is already antibody against platelets that has developed. So once you give more platelets, there are chances of the things getting more and more worse. Now what are the contraindications that we see in case of heparin as well as low molecular weight heparin? If the patient is a hypersensitive patient, if the patient has experienced hypersensitivity earlier, we should think twice before giving heparin and low molecular weight heparin. If there is a bleeding disorders like hemophilia, thalassemia, in those cases we cannot give. If there is a evidenced thrombocytopenia, in those cases also we cannot give heparin as well as low molecular weight heparins. And if there is a recent intracranial hemorrhage, because the patient is already bleeding, the patient has bled inside the brain, in those cases also we cannot give heparin as well as low molecular weight heparin. And there are other causes like GI ulcerations. If there is a peptic ulcer which is developed, the patient has caused hematemesis, we cannot give heparin as well as low molecular weight heparin. Then there are other causes as well, like threatened abortions. There are advanced renal or hepatic disease also which cannot be given. And in all these cases, suppose that it was contraindicated, it's better to avoid those things. But there are some cases where there are contraindications, but we do have to give those. And in those cases, if we administer any or we experience any side effects, we can go for the antidote, which is protamine sulfate in case of both heparin as well as low molecular weight heparin. But the chances of recovery from heparin is much more when antidote is given, but with low molecular weight heparin, it is comparatively much lesser. How do we give protamine sulfate? Protamine sulfate is given for every 100 units of heparin, we have to give 1 unit of protamine sulfate. So how much we have given to the patient and how much the patient has got, accordingly we give protamine sulfate, and then we can reverse these conditions. But in case of low molecular weight heparin, it is comparatively much lesser. So even the side effects are lesser with low molecular weight heparin. So in recent future, we will be using more of low molecular weight heparin, and where there is a need for heparin, we will be using heparin. The thing about saying all this is why we are talking about anticoagulants, because anticoagulants have played a very significant role in reversing conditions where there is a development of a thrombi or embolus. Thing is, when we talk about heparin or low molecular weight heparin, it doesn't dissolve clots like the other we have a tissue plasminogen activators do. So it only reduces the extension of those blood clots, and it makes the blood thin so that there is proper flow to the organs and there is no further damage. But when it acts on the body, slowly those clots also start dissolving, but it's very slow, as in the case of heparin, but not like in the case of tissue plasminogen activators, which are really fast when they dissolve clots and they give you relief. At the end, I would like to say one thing only, that heparins and low molecular weight heparins have changed the modality of treatment in the recent part. It's not that it's recent, but it has been going on for some time now. It has really got a very, very magical effect when given at the right time, in the right dose. And we must also see, when we are giving all these things, we must be monitoring the side effects and we must be knowing what are the contraindications, so that when we are giving, we should know when to benefit the patient and when to see the difference between benefit and harm. When the benefit is more, we have to go for the treatment with heparins or low molecular weight heparins. But when the harm is more, we should think twice before giving it. So that was all about my talk on anticoagulants in different thrombotic conditions. Thank you so much, and thank you Biological E Limited for arranging this video podcast.